This is a Medicare special bulletin.
Hi, I'm Carolyn Tamaka, your local senior health plan advisor. The Medicare annual enrollment period begins October 15th and ends December 7th. This is the only time that most people can change their Medicare health plan. Whether you come to one of our local meetings or we meet with you in the privacy of your own home, HRBC Insurance can help you find the right health plan for your needs. Call HRBC Insurance today.
Well, as I mentioned at the top of the show, that you've got probably about a month left to do open enrollment. It's December 7th is the last day of that everything needs to be in. So it's timely that we have on Carolyn Tamaka here with HRBC Insurance, Medicare Made Simple.
We hope so.
We hope so, yeah, because
We try.
it's confusing, I think, for folks every single year, because every single year things change. The plans change, and then even simple Medicare, and I'm using the word simple because you put it there, although I don't know. A lot of people who are just starting on it are very confused by it because there's so many different things, Medicare Part B and Part D and all this kind of stuff, and every year it changes, right?
Yes, absolutely.
And this year, although the new affordable health care does not affect the people who are on Medicare or at that thing, I heard over the weekend that some of the major calls that they're getting and information are just that. People that are on Medicare, about to go on Medicare, qualify for Medicare, are going, how will the Affordable Care Act affect me? Am I supposed to go on that?
Exactly, yes. That's been a huge question. We've been getting much more inbound calls lately about the Affordable Care Act and how is that going to affect me. And the rules and regulations that go along with that do not affect Medicare directly. There are some indirect changes that have happened, some things with Part D, but those have been in place for a couple of years now. What we're really getting is this guaranteed issue? Does it apply to me? Do I need to go buy health insurance on this California exchange? No, they don't. We're really glad that they're calling in and asking these questions because it is giving us the opportunity to address other changes that are happening, but healthcare reform is not directly affecting them.
Okay, and that's a very important thing because, as I said, you're getting calls, and I heard that on a news show or whatever I was listening to, that a lot of people are calling in about that. There are a lot of plans out there, many plans.
Yes.
And there are folks that have maybe been on Medicare for a few years on one of these Advantage plans, HMO type plans, and have been satisfied with it. It's worked for them. But these plans change every single year. Some are a lot of changes, some are tweaked just a little bit. So it's always a good idea to go over these every single year and see what the changes are.
Yes, definitely. I just spoke with a woman a couple of weeks ago who's been with a certain carrier, I won't say who, that's been working out just great. It's a good plan. But unfortunately, she wasn't digging deep enough, wasn't looking at the formulary, wasn't looking at some specific benefits she was utilizing over and over again. And when we did the math, she really could save a significant amount of money just by changing a plan. Her doctors would stay the same, her pharmacy would stay the same, but over time, over the course of a year, she would save a few $100s just on some small services.
Things like co-pays and things like that.
Yeah, co-pays,
or
urgent
whatever.
care, somebody getting an MRI quite often, or certain prescriptions if they can save, even if it's $5 or $10 a month, it adds up.
Yeah, it does. Now, besides the Advantage plans, if somebody just wants to enroll in straight Medicare, can you help them with that as well?
We do assist people if they're new to enroll on Medicare. I have an email template with instructions specifically guiding them through how to apply online if they would like to, or they can visit their local Social Security office or call Social Security over the phone. but there are some ways we can help guide them through that process because there are certain dates, certain forms, and we're experienced in that manner. After the fact, once they do have original Medicare, that's when we will take their doctors, their prescriptions,
Okay.
and all of that. And whether it's an HMO or a PPO or a Medicare supplement, we help them define
Okay.
which would work best for them.
Okay, that's good to know. Now, you folks often have events and things like that, don't you, where people can come to and learn more information?
Yes, we happen to have one tomorrow in San Juan Capistrano at the
Okay.
Senior Center. We have a Medicare open enrollment resource fair, so a little more fun than just your sales meeting at a COCO. So we wanted to make it more fun, have some raffle prizes. We have a really great dentist coming, a pharmacy, a vision provider, some doctors. So they can really speak with people in the general area and get some information about who's actually providing these services in my plan.
Once someone does enroll, they come to you, you help them out, they enroll in one of these plans. How can you help them throughout the year? Are you there for them if they have questions or?
Yes, definitely. I get calls about little things all the time, and I'm glad to answer those questions. That's what I'm really here for. Just yesterday, I got a call from a client saying, I just got this bill from urgent care, should I pay it? And I'm glad that they call me first because maybe it's not correct.
Right.
And even if it's $20 or $30, it's their money and they should be making sure that that benefit's correct. Also, if there's a claim issue and something's not being paid or if a referral's not being issued, we can help with that.
In the past, there have been different enrollment period dates, as we know. Sometimes they've gone all the way to the end of December. This year, it's December 7th. And then sometimes they have had a period that afterwards, someone realizes this plan isn't right for me, that they can change or go back on straight Medicare. Do you know if that's the case this year?
Yes, there is a Medicare annual disenrollment period. It's
Okay.
not the most commonly known enrollment period, but January 1st through February 14th, if somebody is not satisfied with being on a Medicare Advantage plan, they have the ability to disenroll back to original Medicare, possibly join a supplement or a Part D plan. Also during the general year, the lock-in period, there are special election periods for people with chronic illnesses, cardiovascular disorders, diabetes, people with low income. So we're able to help facilitate that plan change if need be. They just need to call us.
Okay, and I think that's important to know because, as I said, throughout the years, it's changed as far as the disenrollment period. And I think at even one time you could change a plan or something like that. I mean, it's changed over the last 10 years quite a bit, hasn't it?
Yes, it has changed drastically. We used to have an open enrollment period all the way till the end of March.
Yes, that's right.
A few years back, yes. So during this time, we really want to get people onto the right plan for them for the next year. But if for some reason they are not satisfied, we may be able to still help them.
Okay.
I mean, it doesn't hurt to call.
Okay.
There are so many enrollment periods, our heads spin. So I couldn't imagine trying to be a senior and figure it out themselves.
Yeah, and folks that are just turning 65 soon, if they're approaching 65, let's say they're going to be turn 65 in January or February, whatever it is, at this point, can they get on one of these plans? Do you know is it 64 and a half, or what? Do they look at the year ahead, saying, well, I'm going to be 65 next year, can I get on one of these plans right now?
You know what? The sooner the better.
Okay.
We like to speak with somebody at least 3 months in advance. That's their open enrollment period, just to make sure if there's any changes we need to make, if there's anything we need to clarify. We want to make sure they get their ID card in time. But even
Okay.
if it is before that open enrollment period, 6 months in advance, I do like to start to get to know somebody, what their needs are, make sure we get everything in line so when we get to that open enrollment period, it's easy.
So it's 3 months in advance of you turning 65?
Yes,
that
of when
someone
you can officially enroll into a
Now,
Medicare
what
plan.
if someone is turning 65 in June? Will they have the opportunity in March to enroll, or they have to wait all the way to the end of next year?
Yes, they will have the opportunity in the middle of the year based on their birthday. So if their birth date's June 15th, their effective date is June 1st.
Okay.
It rolls back to the first of the month. And then 3 months prior to that, we would start looking at applying for Medicare, applying for the health plan, getting all of that straightened out.
And they would stay on that plan for the remainder of that enrollment year?
Yes.
Okay, so it might be a partial year or
Oh,
however
yes,
it works.
exactly.
Okay, that's good to know, because I think, again, someone might think about, well, I'm 64 now, I'm turning 65 next year, you know, I won't be eligible till a year from now or whatever it is, but that's not true. It's 3 months before they turn 65.
Yes.
All right, good to know. Someone wants to contact you, the number's on the screen, 877-651-7526. And HRBCinsurance.com, is that another one there, your Medicare2014.com as well?
Yes, that's a specific website
Okay.
that we have just for information for this year, but HRBC Insurance is our all year round website.
Okay,
Yes.
very good. Carolyn, nice to have you on.
Thank
It's good information. I think you made it simple.
I hope.
But for folks who want to, are at that point in time to enroll, again, you got about a month left. Now is the time to give them a call. And many plans out there, especially if you're new, it can be confusing out there. There's a lot of choices, and Carolyn can help out. Edgar can help too. He's not here today, but he can
Yeah,
help too.
Edgar is at another one of our sales meetings
Okay.
today, so yes.
All right, nice to see you again.
Nice to see you, thank you.
All right, we'll be back in just a moment.